The placement of IVs can be difficult and requires a lot of skill in performing a lot of tasks. One of the most important skills is being able to locate the best vein for an IV. If you take the time to locate the best site, your chances of success will increase drastically. So how do you find the right site? What makes a good site? This video will address these and other questions to help you set yourself up for success. There are two main strategies for site location. Some people look for veins, as in with their eyes. Sometimes veins will bulge out of the skin and you can see them easily, and other times people will look for the bluish tinged outline of a vein beneath the skin. Others will look for a vein with their fingers, gently running their fingers over the patient's arm to feel the vessels. Vessels will feel like a slight bump in the arm, and if you press on it, the vein should be spongy and rebound to its original shape after you release pressure. If the bump you feel is hard, it could be a tendon or ligament, or it could be a vein that has developed a lot of scar tissue. Even if it is a vein, this is not an ideal site. Veins with scar tissue will be more difficult to access, and their integrity is already compromised from previous damage. Find a location that gives that spongy feeling, and you'll be more likely to have a successful, long-lasting IV. Also keep in mind, people's bodies are generally built the same way. There will be variations from person to person, but the main veins are going to be in the same general location for each person. You can look at mapped out pictures showing all the names and locations, but through practice you will probably find your favorite veins. What are you looking for in a vein? A good vein is important. Larger is better, and you'll need a stretch of vein that is straight for the length of your catheter. The catheter won't be able to bend around corners in a vein, so you need to choose a location that allows for it to slide completely in and remain straight. So where are the best places to place an IV? You've probably seen a lot of IVs placed in the AC. This is inside the bend of the elbow. There's a nice big vein here, and that's why it's always a very common placement, but it is not ideal for a patient laying in bed all day. It's uncomfortable, and every time the patient bends the elbow, it will kink the catheter and impede the flow of fluid or medication through the IV. In general, try to avoid placing IVs in joints for this reason, so wrists shouldn't be a first choice either. Another reason wrists are not ideal is the presence of nerves, tendons, ligaments, etc. On the underside of the wrist is usually a very visible vein, but this location tends to be problematic and painful because of the joint and the pressure the catheter can put on the other structures in this area. But if you trace that vein further up the arm, you may find a much better site. There are usually some visible veins in the hand, and while these are good for lab draws, they aren't ideal for IV placement. Even if you successfully avoid being near any knuckles or wrist joints, it will still likely have issues. People use their hands for a lot of things, meaning lots of movement. More movement means more likelihood of the IV being dislodged. Also, because of where hands go, they get dirty really easily, which increases the risk for infection. And they tend to be more sensitive and painful in general, so hands aren't a first choice for placement either. Arguably, the best locations are in the forearm. There are plenty of large, straight veins and no joints. Do a thorough search for veins in the forearm. Look on the top. Look on the bottom. And move the arm around at different angles, and you may reveal some excellent untapped veins. While forearms are arguably the best option, the other sites mentioned are also viable options for placement. But as discussed, they come with more potential drawbacks and issues, so choose your locations carefully. If you don't see something you feel like you can successfully place on the first arm, look on the other arm. Take your time. The biggest mistake people make when placing an IV is rushing while looking for their right vein. If you take your time and find the best vein, your chances of success will skyrocket. Once you've located a site, find a way to mark it, or make note of where the vessel is. You can use a sterile body marking pin to trace the vessel, or use freckles, moles, scars, or other landmarks to remember the location. Because after the site is found, you need to remove that tourniquet, and you may lose visualization of the vessel. In some cases, you will be able to look on either arm to find the best site, wherever it may be. But with a lot of patients, there will be some limitations to where you can place an IV. If a patient has had lymphedema in the past or breast surgery with lymph node removal, you cannot place an IV in the affected arm. If the patient is a dialysis patient with an AV fistula in an arm, you cannot place an IV in that arm. If the patient is a renal patient in any respect, even if they are not currently requiring dialysis, avoid placing IVs in the AC. If the vessels in this area are damaged from numerous IV placements and lab draws, it can cause significant problems if they need to place an AV fistula for dialysis access in the future, and that could be the difference between life and death for a renal patient. Only the vascular access team is allowed to place IVs in the lower limbs. If the upper limbs are unusable, there are many factors that will come into play to choose a different access device or potentially place a peripheral IV in the legs or feet, and the vascular access team will assess the patient's needs in these cases. Be aware of these and any other limitations to site selection that your patient may have before accessing a vessel. Site location is a pivotal step in placing an IV. It's often rushed, and people settle for the first okay vein they come across. But always allow yourself the time to find the best vein. A little extra time searching can save you all the extra time you would take attempting multiple pokes. You'll thank yourself later, and your patients will thank you too.